2023. Today we have the fellows taking over the room, and maybe I'll just leave it at that. Welcome to Christmas Rounds 2023. Thanks.
So hello, everybody. My name is Jacob. I'm one of the first-year cardiology trainees presenting on behalf of all the cardio fellows. We're very happy to be with you all today and to have organized this grand rounds today. It'll be split in two parts. We're going to start with a 15 or so minute video, just poking some light fun at cardiology, at the CCU, at ourselves. And it's all in light fun, and we hope you enjoy that. And then afterwards, we'll be moving on to what I understand is a yearly tradition in Jeopardy. So we'll start with this video, and we'll take it from there.
Every now and then I get a little bit nervous that the best of all the years have come by.
Turn around. Every now and then I get a little bit terrified, and then I see the look in your eyes.
Turn around, bite eyes. Every now and then I fall apart.
And I need you now tonight, and I need you more than ever. And if you only hold me tight, we'll be holding on forever, and we'll only be making it right, 'cause we'll never be wrong.
I've got to do the news!
But I am telling you right now, that motherfucker back there is not real.
I love talking about it, by the way, so if I cry, it's only like...
Don't cry, don't cry, don't cry, don't cry, don't cry. Don't cry.
Destination unknown as we're pulling for some gas. Officially placed a poster, reveals a smile from the pack. Elephants and acrobats, lion, snakes, monkey. Village speaks righteous, Sister Cena says funky. How bizarre. How bizarre. How bizarre.
Ooh, baby. Ooh, baby. It's making me crazy.
Quite a few times.
50 times?
More.
100 times?
More.
200 times?
More.
500 times?
Probably.
What do you want? What do you want?
It's not that simple.
What
It's...
do you want? God damn it. What do you want?
Wouldn't it be nice if we were older and we would have you in so long? The hardest thing to do, but you gotta make your own kind of music, sing your own.
Oh, hi, is this CCU? Hey, thanks for calling. It's Doc in the Merge here. I have a few consoles for you. I hope your night's going well. Those are some really good ones with good learning value. So first one has long-standing GERD, ran out of his PPI a week ago, and now it's coming with heartburn. I wonder if it's cardiac. I'm hoping you guys can clear him. Second one, he has some other issues going on, but I just wanted to clear from a cardiac perspective so we can admit him to another service. Yeah, normal troponin, normally CG, don't worry. Last one, he has a troponin, it's 5, it's normal, but it's there, so he has a heart. So I'm just wondering if you can get your blessing so he can go home. Yeah. No, I didn't examine him, no.
Each time when I come here, I am abused.
So I've just been invited to the home of someone very near and dear to the Foothills Hospital and who's working behind the scenes and is an expert in his field. Let's go meet him. And I'm here with the specialist, the mastermind behind the name generation at AHS. It's such a pleasure to meet you. What's your name, by the way?
Ankh.
Oh, it's nice to meet you, Ankh.
Yeah.
I have to ask, how do you do it?
Well, it comes really deep from the heart. I take inspiration from the world.
I'd love to see your work.
Okay.
You sure about that? You sure about that? You sure about that? Over now. Keep me coming back for more. Baby, you're all I want. When you're lying here in my arms.
Yeah, I had a good time.
Okay, that's good. And now, wouldn't you want those good times to keep going? Have more good. I don't understand it. I don't know why it's so hard for you to admit that you want this.
Guess who's back?
What are you doing?
Nothing. Me? Just hanging around.
But you see that sucker over there? 0 to 60 in 4.1 seconds. It's
What's going on? You know
what she said to me.
I'm done.
She said,
Cut the show.
"You're a
I'm done.
player,
Take
and
me
I
out.
bet you got hoes."
I love you, Tutus.
Nếu mà tao vào về bùi dây on the đi coi về rồi rồi thấy mày kéo không vào về bùi dây trái.
Soon, but then he turned the little button and the car went.
It's been 84 years.
Look at me, sure. Look at me, sure. I'm the captain now.
All right, you overgrown gecko. Come and get your...
Imagine me and you, I do. I think about you day and night. It's only right to think about the girl you love and hold her tight. Happy Christmas together. If I should call you up, in best of time, and you say you belong to me, that ease my mind. Imagine how the we're so very fine. Happy Christmas together. I can't see me loving nobody but you for all my life. When you're with me, baby, the skies will be blue for all my
All right, so that's it for the video. So again, shout out to John for the very masterful editing there, as well as to our wonderful actors. We hope you could find that relatable in one way or another. Now we'll move on to the next portion of our rounds tonight, which is the Jeopardy, which, as I understand, is somewhat of an annual tradition. Let me just try to get it started here. All right, there we go. Perfect. So I'm going to unmute the microphones in the room so all of you can be heard right now. We invite participation from everybody. It's going to be in the usual Jeopardy style. So Basically, we ask you to answer with either what is or who is. And in case you're a little bit unsure what exactly the answer is, it'll be hinted by being underlined in the stem, in the statement. If you get the answer incorrectly, we do allow for steals. Once again, we invite everybody to participate. We'll be keeping tabs of the points, and there's a little prize for the winner at the end. I do apologize, one little technical glitch with the game. Usually when we click on a question, it will disappear when we come back to the board, but that won't be the case. We don't have that level of PowerPoint abilities, so we'll just be keeping track manually. And if you're unsure, ask us which question.
You gotta check on the prize in case it's an extra night on call or something.
I can assure you that the prize is not an extra night on call. I should have thought of that, Dr. Kavanaugh. All right, so we'll get it started. Maybe Dr. Kavanaugh, could you start us off with the first question? So, oh yes, I should go through the categories. Right, yeah, I'll just go quickly through the categories. So history matters, some quirky historical facts about cardiology. Human resources, some fun facts about our staff, residents and nurses. Picture this, which is some visual cardiology questions with various imaging. Born ready, I'll let you find out what that is when we select it. And then bad call karma. I think that one speaks for itself. So which one did you want to start with?
Bad call karma, we'll go for 500.
Oh gosh, we're starting big now. All right. So this malfunction shown on the IABP tracing above causes increased LV workload and decreased cardiac output.
Where's my partner? Come on. No, Jordan, come on, Jordan, what is this?
Anyone can. Yeah. Jordan said, what is late deflation? That is correct, Jordan. Very good. Excellent. Yeah, so just very briefly, the balloon hasn't completely deflated before the onset of systole, and so that causes increased workload on the LV. Great job, Jordan. So that's 500 points for you. Would you like to select our next question?
Born ready for 100.
Born ready for 100. Perfect. Name this cardiology fellow. Who has? Yeah, so what answer did you say? That is correct. Thank you very much to Dweep for providing us with this.
That was the year before fellowship, and then he aged all this.
All right. Next one.
Oh, human resources 200.
Human resources for 200. This cardiology staff is the longest standing cardiologist working within the.
Sheldon.
Oh, Dr. Kavanaugh, yes, that is correct. So Sheldon, well done. Perfect. So back to you, Dr. Kavanaugh.
Oh, pictures, I guess, for 400.
Picture this for 400. This cardiomyopathy classically causes the finding shown above. Yes, that's correct. Also, eosinophilic endo or myocarditis. Very good. Very prothrombotic within the endocardium can lead to the formation of ventricular thrombi. Can you give us the next one?
Bad call karma for 100.
Bad call karma for 100. Name this complication shown on chest X-ray.
Pacing delivery. Pacing screen.
Who would like to formally answer this one? Through us? So it would be what is?
Yeah. What is a perforation?
Yeah, that's correct. What is RV perforation post pacemaker? Very good. All right, so for us, could you start the next one?
Born ready for 200.
Born ready for 200. Name this CCU nurse.
Kevin.
That is correct.
What is
Very
Kevin?
good job. Yeah. So back to you for us once more.
Human resources for 200.
Human resources for 200. Oh, we already did this one. Sorry.
300.
Human resources for 300. This CCU nurse also volunteers with the Calgary Search and Rescue Association.
Who is Laura Kwok?
That is correct, Laura Kwok. So this was a very cool fact that we found out, and we just want to say, Laura, you're awesome and very adventurous as well. All right. Next one for us.
I'll give this to Dr. Kavanaugh.
Dr. Kavanaugh. All right.
So I have to
Forfeited
pick
his
Born ready, for 400.
born ready for 400. Name this CCU nurse. Dressed as a crayon.
Davy.
No, that is incorrect, Dr. Kavanaugh. Anyone want to try for the steal?
Who is clinician at Glenaga? Yeah.
That is correct. That's our charge nurse, Trish. Thank you also, Trish, for providing us with this awesome picture. All right, maybe Trish, how about we get you to pick the next one?
History matters 500.
History matters for 500. This procedure performed in 1895 in Oslo is recognized as the first documented cardiac surgery. It's a tough one.
Is it repair of a coarctation?
No.
Or patent ductus arteriosus?
No, we're talking actually like heart surgery, not aortic surgery. That's a good guess though, Wasim.
Mitral stenosis?
No, not mitral stenosis. Good guess as well, Dr. Isaac. Any other ideas? This is a tough one.
What is bloodletting?
What is bloodletting? Not quite, but close. So it was actually ligation of a bleeding coronary artery. So interestingly, a 24-year-old man had been stabbed in the left axilla and came into hospital and was in deep hemorrhagic shock. And so this was thought to be the first cardiac surgery ever done. Unfortunately, he did die 3 days later of mediastinitis. So we've learned a lot since 1895. All right. Who would like to pick our next question? Maybe Dr. Isaac, can I invite you to pick our next one?
What's left for history matters?
History matters. We have anything 100 through 400.
300.
History matters for 300. This Bronze Age civilization was the first ever recorded to use salicylic acid, precursor for aspirin, for medicinal purposes. Nope, not the Aztecs. Also a good guess.
Is it the Greeks?
You're getting geographically closer, but it's not the Greeks. You got to go a little further east.
Persians?
Very close. You know what, Dr. Howarth, we'll give it to you. It's actually the ancient Sumerians who were very close to where the Persians were. Soon after, they actually used willow leaves for rheumatisms and fever. And later, these willow leaves would be used to isolate salicylic acid, which is where we get aspirin from. So kind of a cool little factoid. So Dr. Howarth, could you pick the next one for us, please?
History matters for 200.
History matters for 200. This procedure, developed in 1963, is used to correct transposition of the great arteries, and it is also a condiment.
What is the mustard?
Oh, I think Tobin, you had your hand up.
Yes. What is the mustard?
What is the mustard procedure? That's correct. Yeah. Actually developed at the Hospital for Sick Children in Toronto in 1963 by Dr. William Mustard, and dramatically improved survival in patients born with TGA. So very good. Tobin, would you like to take the next one for us?
This for 300.
Picture this for 300. Yeah. So this syndrome classically causes the valvulopathy shown above.
What was carcinoid?
What is carcinoid? Excellent, excellent. Yeah. So carcinoid syndrome, neuroendocrine tumor originating in the gut, metastasizes to the liver, and secretes lots of vasoactive peptides, including serotonin. For reasons that are not entirely clear, causes remodeling in the heart, such as thickening of the mitral valve, of the tricuspid valve leaflets, and gives this classic drumstick appearance. This is a case I saw a couple years ago. So very cool pathology. Good job, Wasim. Would you like to pick the next one for us?
For this for 400?
We had already chosen that one. You still have 100, 200, and 500.
500.
Picture this for 500. This congenital heart condition presents with the characteristic features shown above. Wasim, back to you.
Metrology fellow.
What is citrology fellow? Perfect. Don't want to put you too much on the spot, but do you want to name the 4 characteristic features? No, never mind. It's okay. We got a PST. We got an overriding aorta, pulmonic stenosis, and an RV.
Actually, I'm wrong.
RVOT obstruction.
Yeah.
It's.
RVOT, true, RVOT obstruction. Thank you for the correction, Dr. Isaac. Perfect. So Wasim, back to you.
What's left in bad call karma?
Bad call karma, we've got 200, 300, and 400.
400 in bad call karma.
400, perfect. This drug is given as an antidote for levofed extravasation. Wasim, back to you.
Pentyramine?
Close.
Pentolamine.
I think Tobin took the steal, so I'll give you points to Tobin. Good job.
So I was thinking pulmonary hypertension drugs.
It's good. I like to see the competitiveness. That's great. Perfect. So Tobin, back to you.
Bad call karma 200.
Bad call karma for 200. Prolonged infusion of this drug can cause patients to develop the smell of bitter almonds on their breath.
What is nitroprusside?
What is nitroprusside? Well done, Wasim. Very good. Very good. So this is due to cyanide toxicity, which is a rare, but it is a complication we have to be aware of with prolonged nitroprusside infusions. The textbooks say bitter almonds. I personally don't even know what bitter almonds smell like, but that's what we are taught. All right, so Wasim, back to you. You can see who's been studying for their Royal College.
History matters for 200.
History matters for 200. That was already done. So we have 100 and 400 for history.
100.
History matters for 400. So the first stethoscope was introduced by French physician René Laennec, and this year we'll give a margin of error of 15 years. So as long as you're within 15 years of the right answer, we'll give it. Just guess this for a year.
75.
1875, close. You got the right century, Dr. Chanel, but we're not within 15 years. Anyone for the steal?
1830.
1830. Dr. Kavanaugh will give you the points there. So it's 1819. Very good. And the first stethoscope was actually made of wood and was born out of necessity. Dr. Laennec felt very uncomfortable examining or auscultating the heart, as physicians used to do by putting their ear directly on the patient's chest. So he found a slightly more distant way of auscultating. All right, very good. So Dr. Kavanaugh, we've got a few more questions left. I'll let you know based on the category you choose.
Picture this.
So picture this, we've got 100, 200, and 500.
Oh, 500.
All right, picture this. Oh, no, actually, no, sorry. We did 500. So 100 and 200.
200.
200 it is. Name this vascular abnormality. Oh, some hands are sort of up. Wasim?
What is an anomalous left main from the right?
Absolutely, very good. So that's anomalous origin of the left main coronary artery as shown on CT. Very good. Do you want to take the next one for us, Wasim?
Matters for 200? Is that left? 300?
No, we have history matters for 400.
400.
400 it is. The word stent derives its origin from Charles Thomas Stent, a 19th century Englishman who practiced this profession. This one's a bit of a unexpected. I was surprised by this.
He wasn't a plumber, was he?
He was not a plumber. He was not a plumber.
Chicken farmer?
Not a chicken farmer. It was within healthcare, within medicine more broadly.
Barber at that time.
Well, he wasn't a barber, a surgeon.
Is it dentist?
That's correct. Yeah, so dentistry. So at the very beginning, Dr. Stent here was credited with creating a material used for dental impressions, which would later make its way towards surgery And his name was given to certain procedures such as biliary anastomosis, where they would stent biliary ducts. And then later in the 1980s, made its way to cardiology. And where we get our coronary stent terminology from. Very good for us. So back to you.
Born ready for 500.
Born ready for 500. Name this cardiology staff.
Kavanaugh.
Dr. Kavanaugh, that's correct. Very good. Was that you, Dr. Wilton, who answered that one? Perfect. So that's points to you. Would you like to take the next one for us?
Sure, is anything left in human resource?
Yeah, so human resources, we've got 100. Let's do it. So human resources for 100. This cardiology fellow completed 3 years of cardiac surgery residency before switching programs. That's correct. That's correct. Dr. Kavanaugh, points to you. Actually, forgive me, it's my mistake. We do actually have, I believe, 400 and 500 as well in human resources. Yes. Yeah, we do still have 2 questions in human resources.
Oh, human resources, 200.
Human resources for, no, we have 400 and 500.
Oh, sorry. 500.
500. This CCU nurse used to work a summer job deveining cattle liver, and this convinced her to stick to nursing. Any thoughts? I'll give you a hint. She's in the room right now.
Russ?
Yes, that's correct. Yes, that's Catherine. That was a very cool factoid that Catherine shared with me yesterday. And I didn't even know that deveining livers was a thing until yesterday as well. All right, so back to you, Dr. Kavanaugh.
What's left?
So what's left? We've gone through history matters. For human resources, we have 400. For picture this.
Let's do that.
Perfect. This cardiology staff also has a PhD in anatomy and cell biology.
Ours?
That's correct. Dr. Howard, excellent. All right, so that leaves us with picture this for 100, born ready for 300, and bad call karma for 300. So 3 questions left.
What was born ready again? Which one?
Born ready for 300.
Okay.
Name this cardiology staff. What's the name?
Sandeep Agarwal.
That is incorrect. That's correct. Who is Dr. Joshi?
Did you walk in?
Just for context, Dr. Joshi literally walked in. Very good. So that leaves us with picture this for 100 and bad call karma for 300.
Picture this.
Picture this. Oh, a patient with Takotsubo developed this complication.
What is a free wall rupture?
That is correct, Wasim. Good job. Ventricular free wall rupture. And our last question before our final Jeopardy is bad call karma for 300. So this cardiac condition can result in sudden death.
What is the RBC?
What is ARVC? Very good. Very good job. So this was, the finding is kind of small here for on the ECG, but we do see epsilon waves. And then there are T-wave inversions in the precordial lead. So that points us to ARVC. All right, very good. Very good. So I believe that completes everything. I just want to make sure we didn't skip any questions here. Yes, okay. So we'll move on to our final Jeopardy. Final Jeopardy. This American company is responsible for our modern depictions of Santa Claus. So I will invite those who answered questions during the Jeopardy to take 30 seconds to a minute to think of their answers and how much they would like to wager. Unlike the typical Jeopardy, we'll let you wager as much as you want. So among those who answered, we have Dr. Kavanaugh, we have Tobin, we have Dr. Howarth, we have Faraz, and we have Wasim, we have Trish, Jordan, and if there's anyone else that I forgot, please. Oh, Dr. Wilton, yes. And if there's anyone else that I forgot as well, please also feel free to. Just for context, by the way, Santa Claus used to be much rougher around the edges. As you can see, this is a depiction of Father Christmas from 1895 in Britain.
I'll wager everything.
You want to wager everything, Dr. Howard?
Whatever that is, yeah.
So we'll let everybody come up with an answer, and then when we're ready, we'll go on. Is everybody ready? Anyone need more time? All set. Okay. So would anyone like to answer this one for us? Dr. Howard?
Coca-Cola?
That is correct. Coca-Cola. Good job. All right, so we'll be counting the points and getting back to you. I do believe offhand that the winner is Wasim. So we give him a round of applause. Studying for Royal College also wins you prizes during Christmas rounds. It's great.
Imaging fellowship picture. This is perfect for you. It was helpful.
So that concludes what we had ready for you. Once again, thank you, everybody. I can say, at least on my part, it's been a real pleasure coming to Calgary and working with you all. And we look forward to the many more months and years and falls to come. So thank you very much.
They're gonna go down in Calgary history.